So, with this, I now invite Dr. Santosh Kraleti, who is also very briefly going to talk about this topic to help us anchor the discussion before we move into the moderated panel discussion. So, may I have Dr. Kraleti's slides, Pata?
Okay. Thank you very much, Dr. Abha. Uh, my slides are much more simpler, and because we have so much that we have already seen in terms of data already, and what Dr. Abha just has shown, we have seen in a study in National Medical Commission. And when we did a survey, we were quite startled for the first time, like, something of the sort is there existing in our system. And we did that only because of the big trigger that we had in Arjikar Hospital in Calcutta. So if you look at a couple of things, I would just like to take all of you back to probably, many answers wouldn't have watched. But then probably people who are around 35, 40 who have seen something probably heard of Jadoo Ki Jhappi. I'm sure you would have heard about Jadoo Ki Jhappi. And you would have seen that movie where Sanjay Dutt goes and hugs many workers in the hospitals. Do we have that kind of an environment in our systems, in our healthcare systems? Or, for example, when we work with a lot of house surgeons, postgraduate students, they're so stressed up. So many workers. And we know that they're doing the job which is sometimes, many times, thankless. After doing your 72-hour work, probably someone is attacking the doctor or the postgraduate student in the ICU or probably in the ward. And we have seen this sort of cases. And very recently, what happened? I'm sorry? A slide change. Slides. I can change it, right? Yeah. Yeah, thank you. I have only 4 slides. So, yeah, thank you. So, you see that many times, very recently in Telangana and in Andhra, we have 2 medical students who have committed suicide just 1 week back. 1 week back. We don't get headlines and we don't observe what's happening. And many times the stress levels are very, very high. And the reason I know myself as a medical college student and with one of our superintendents with whom I worked, she said that I go and breastfeed my child. Why? And she told me that within 1 week after my delivery, no one told to breastfeed, but everyone asked me to come back to work. She was a housey at that point of time and she was doing houseman job, and that was the situation. So the kind of stress. And she said that only in her second delivery, when she was in a proper, she finished her NVDA, she went with her husband wherever he was working, that she could breastfeed a second child. So this is the kind of stress levels and this is the kind of work ethic that we have. And we don't talk about it. Many times we don't talk about it because as a country, you know, most importantly, we have a family to some many times to support us. But for those people who don't have a family to support or probably who don't speak to their family, what kind of family stress or trauma that they're undergoing. So I think it's very, very important to understand the nuances what Dr. Abhan has just put forward. I'll just take you to this slide. Culture of 3 C's: compassion, care, and cheerfulness. If a hospital has someone probably at the top leadership level, and this is percolating down, who smiles, who welcomes everyone, and probably that will have a ripple effect. And the compassion and care and cheerfulness is something, if we give, if we sow this, that's what we'll reap. Everyone comes out with a cheer, everyone comes out with care and compassion. So, how compassionate is our work environment in our hospital, in our healthcare system? I think this is very, very key. Is there someone like this doctor who is hugging his healthcare workforce, not just doctors in his hospital, but everyone around? And empathetic, not just sympathy, but are they empathetic? Words turning into actions. And just look at this person. Just look at the smile on his face. Can we bring that in our workforce? And how will your patients be treated if your workforce is not treated well? So, how do we need to treat our own workforce? How do we take care of them? And what do we do? And I think that is what is the essence of, redeeming the spirit of medicine. Yeah. And I would like to show this small video. Can we play it? Me. Just look into him. Innocence, happiness, and how she's feeling the words that are being spoken. Can we have the sort of a time in our hospital healthcare system where we can reflect, where we can pray, where we have a spiritual corner where people can go and say, talk to someone, speak their emotions, and you have this sort of a system in place? Thailand has a very unique system. They have in their accreditation spiritual quotient. No other country in this world has. And Bhutan has started very recently. So, can we bring this into our healthcare system? And someone in the panel has taken that to Bhutan. So, just look at this. You can play this. Thank you. Thank you so much. Over to you, Dr. Abra.